Hi, everyone. Thank you for joining us today for our virtual town hall. Today, we have public health and medical experts answering questions submitted by the public from around the state about the COVID-19 vaccine for children. Before we get started, we will do introductions, starting with Dr. Richard Carmona.
Thank you all for being with us today and submitting your questions about some of the most important things in our lives, our children. My name is Richard Carmona. I'm the 17th Surgeon General of the United States, a distinguished professor at the University of Arizona, and also the Governor's Senior Advisor on Public Health Emergency Preparedness.
Hi, everyone. I'm Jessica Rigler. I'm an Assistant Director over the Division of Public Health Preparedness here at the Arizona Department of Health Services.
Hi, everyone. Welcome to our session where we're thrilled to be here to answer your questions. I'm Dr. Sean Elliott. I am a pediatric infectious disease doctor, so I care for kids with various infections. I practice here in Tucson at Tucson Medical Center, but I'm very involved with the Arizona chapter of the American Academy of Pediatrics. I oversee infectious diseases and immunizations for them. So it's a joy to be here and to be available for your questions.
Now to the first question. The term emergency use authorization concerns me. Are we rushing vaccines into use without fully ensuring their safety?
Well, the question of emergency use authorization is one that I'm glad that parents are asking about because it's our language. We understand what that means, but for the average person, it confuses them. And in fact, what this is just the process by which we evaluate scientific information as quickly as possible to get it out to market when we have a challenge like a pandemic. And we can't afford to wait several years to do all of the research. So the point here is the emergency use authorization tells you that scientists independently have studied this, validated it, and feel that this vaccine is efficacious, meaning it works, and that it does no harm.
As a mom of a 10-year-old daughter, I'm always concerned about making sure that I'm making both the healthiest and safest choices for her. That's one of the reasons I've chosen to get my daughter vaccinated against COVID-19 after looking into the information about the vaccine. The FDA issues emergency use authorizations for products in the middle of an emergency when they can't go through the years-long full review process. However, an emergency use authorization requires extensive study in order to determine whether or not the product that's being authorized is both safe and effective. Tens of millions of people in the United States have been vaccinated against COVID-19, and we continue to monitor the ongoing effects of the vaccine to ensure that it continues to be both safe and effective.
Thank you. Our next question is, how sure are we that the vaccine will not affect the ongoing physical development of kids?
So the vaccine for kids, especially the new indication for ages 5 through 11 and even older, it has been extensively tested for safety. And this is out of a huge abundance of caution. So the FDA, the CDC, all the science organizations have looked at all this evidence, the scientific evidence, to look for exactly that concern. Can the vaccine affect development, muscles, fertility, tissues, organs, heart, lungs, etc.? And the very short answer is no, it cannot. It does not have anywhere, it doesn't have the ability to do that. And even the science behind the vaccine, there's no way, no how that the vaccine can insert its RNA, its genetic code into our DNA. There's no machinery for that. It doesn't exist. So there's absolutely zero way for the vaccine to affect fertility of our kids, absolutely zero way for the vaccine to affect organ systems, development, muscles, behavior, anything like that. Further, the possibility of that occurring has been looked at long term with all the research studies, and there have been zero findings for that. So very long story short, the vaccine is totally safe and has no ability to affect any development of our kids or anybody else.
Dr. Elliott, here's another question for you. What is the risk of a child developing myocarditis after COVID-19 vaccination?
So we know now, as we continue to use the COVID vaccine in adolescents and young adults, that there are a very few people who developed post-vaccine myocarditis or inflammation of the heart muscles. It's important to realize that having the virus itself, actual COVID-19 disease, has a 1,000-fold higher risk of giving that same myocarditis. The actual risks have been studied scientifically. So the risk of getting myocarditis from COVID-19, the disease, is estimated at 0.15%. So it's still not a huge risk, but it's definitely significant. The risk of getting myocarditis from the vaccine is estimated at, waiting for this, 0.000047%. So there's a whole bunch of zeros before you get to that tiny percentage chance. So if you're comparing risks versus benefits, the risk of getting severe myocarditis from actual COVID-19, the disease, is actually quite high. And those patients are super sick. I've managed them and they don't do well. And they don't do well for weeks to months after they recover, if they recover at all. The risk of myocarditis from the vaccine is tiny. And those individuals who do get that myocarditis, the few out of every million vaccine recipients, have their symptoms for a couple days. They may be hospitalized for a day or so. They respond to Motrin, and they're fine within the next days or weeks. None of them have had any long-standing effects from the vaccine. So it's a night and day difference. Absolutely, the risk is far worse with disease versus the vaccine.
If young children aren't considered at high risk for serious illness and death from COVID-19, why get them vaccinated?
We've received many questions from you. And as a parent and a grandparent, I applaud you for taking the time to send these questions in. One of them was about if this disease, COVID, isn't that bad, children might get a little sick. Why is it that we should get them vaccinated? Well, because it is a vaccinatable disease. And I would remind all of the parents that are viewing this today, listening to myself and my colleagues, that if you have children, you're used to doing this. When your children are born, they go to a pediatrician and they get a series of vaccinations after they're 6 months old, leading up to when they go to school at about 5 years old, at which time they get immunizations for measles and mumps and rubella and whooping cough. Why? Because those organisms exist in our environment and they can infect our children and make them sick and even sometimes cause death and or significant harm. These are vaccinatable diseases. And the fact is, in our history of the whole world, vaccines are arguably the most important scientific advancement in the history of mankind. So I would suggest to you that first, your questions are good ones. As a parent, I applaud you again for asking those questions. But second, the science is sound. The science tells us this is the right thing to do. And we have a long, long history of understanding how vaccines work and how it's prevented our children from getting all of these diseases that previously could cause serious harm and death. And today we don't see that in society if our children are vaccinated.
Fortunately, in most cases, COVID-19 does not cause severe outcomes in children. However, we do sadly see children hospitalized or dying from this disease, and it is one of the top 10 leading causes of death among children in the United States. The COVID-19 vaccine is so critical to help prevent not only those cases of disease, but also potential adverse outcomes that children may suffer from due to COVID-19. In addition, we still don't know what the long-term effects of COVID-19 infection are. And so it's important to make sure that our children are vaccinated so that they're fully protected against this disease and any long-term consequences from the disease. In addition, getting your children vaccinated against COVID-19 will reduce their risk of infection. That means that they can return to in-person school and all of those extracurricular and fun activities that they're used to doing without having this level of concern about potential exposures to the disease and necessity to quarantine or isolate after being in contact with someone with COVID-19.
In regards to the vaccine, how did they come up with the dosage for ages 5 to 11?
One of the things that the vaccine manufacturers do and that FDA reviews is make sure that they are able to administer the minimum dose of vaccine or medication necessary to receive the maximum benefit. And so many of you may have heard that the 5 to 11-year-old dose for a COVID-19 vaccine is 1/3 of the typical adult dose size. And that's because that 1/3 dose is the dose that you can give to a child that will give them the maximum protection against COVID-19.
You've read in the papers that the dosage for this vaccine is less for a child. Well, how they've come up with this is that they've studied thousands of children over time. And what you want to know is, what is the least amount of this vaccine that I can give to a child to be able to mount the best immune response? So therefore, you're not giving too much. You're not providing only, let me stop that. You are not providing too much. You're providing just the right amount. And what I mean by the right amount is the amount that will allow your child's body to respond and make antibodies enough that it can protect them if they're exposed to the COVID virus. So after thousands and thousands of these children have been tested in various sites around the country, evaluated by multiple scientists and physicians and nurses in a protocol that lets them see if there are any problems. Again, CDC, FDA have come to the conclusion that these vaccines are safe and efficacious. And in the 5 to 11-year-old group, you don't have to give as much, you can give a little less, and in fact, get the same response to protect you from COVID.
Next, why is only the Pfizer vaccine recommended for ages 5 to 11?
At this time, Pfizer is the only vaccine that has submitted an application and received an emergency use authorization from the FDA to be administered to 5 to 11-year-olds. We expect to see additional consideration for other vaccine types in the future. However, it's important to get your 5 to 11-year-old vaccinated as soon as possible with the Pfizer vaccine. You can visit our website at azhealth.gov/findvaccine to find a vaccine provider near you. And there's an option to filter that as well. So you can click the filter on the map for children 5 to 11 to find pediatric vaccination providers near your home.
Will the COVID-19 vaccine interfere with any other vaccines children might need?
So looking at using COVID-19 vaccines along with other vaccines also has been studied extensively. In the early days, and some may recall this, the early days was recommended to wait 2 weeks before or after the COVID-19 vaccine before getting any other vaccines, including the flu vaccine for that matter. Actually, now the science is quite clear that there's zero risk to giving all the vaccines together. So it is absolutely safe, and in fact, it's absolutely recommended to give other needed vaccines at the same time as the COVID vaccine itself. Best example, of course, is the flu vaccine, which we should all be working on right now, because who knows what the flu season is going to be like coming up. But giving the flu vaccine and the COVID-19 vaccine, same time, same visit is safe and a great idea. For other routine vaccinations, and this is a big thing, especially for those of our children and adolescents who have had a delay in vaccines from the pandemic, absolutely it is safe and tolerated and a good idea to give all those vaccines at the same visit as well. So for an example, somebody who is starting their HPV vaccine series or starting the next dose, if that coincides with their need for the COVID vaccine, same visit, fine, perfectly safe.
There are many online claims based on federal data about deaths and injuries from COVID-19 vaccination. Are they true?
Well, I'm very happy that some of you have asked a question about the risk and also asked questions about you've read on social media or in any other forms of media that talk about catastrophic consequences. The fact is they're wrong. There is very, very little risk, if any, to a child being vaccinated. A sore arm, maybe a headache, maybe a little fever, but they all pass. They all pass rather quickly. And when you're thinking about vaccination, you have to do a risk-benefit analysis. I did the same thing with my children and my grandchildren. Is it worth it? Okay, is there risk in this? And if so, how big is the risk? Yet, if I don't give the vaccine, what is the risk to my children? And you parents who have sent those questions in, again, I applaud you for doing that, because it is the right question as a parent to do your due diligence to make sure your children are not exposed to anything harmful. And the fact, once again, is that this vaccine has the ability to prevent a very serious illness. Now, you've read, and I agree, that many children who get COVID, they just don't feel well. It's like a bad cold. We hear it over and over. But as we look at the data, you'll see children that become very, very ill, need to be hospitalized, some on a ventilator, and some who ultimately die. In addition, children who get the disease can get what's called that long haul syndrome, or the chronic inflammatory part of this disease that can go on for months or years, that still hasn't been well defined. But we know that even you recover from the acute event, it can go on for months and years. The inflammation, the pain, the discomfort. And researchers are looking into why that happens. So those are the reasons that you want to get your child vaccinated. You don't want to take a chance that your child will be the lucky one, not to get very sick, not to be on a ventilator, not to get this chronic syndrome of inflammation. And all you have to do is have your child vaccinated to pretty much assure that that won't happen. Again, there are small risks. There are some breakthrough infections, and no vaccine is perfect. Even your flu vaccine, your whooping cough, your measles, your mumps that you're aware of as parents, we still see once in a while the child will get a disease. But when you consider the thousands and thousands of children that are prevented from getting the disease and prevented from spreading it to others, vaccines are again the way to go.
Next question. Does an mRNA vaccine amount to gene therapy that affects a child's DNA?
So a common concern about the mRNA vaccines, the Moderna and the Pfizer vaccines, is that they can somehow affect our DNA or our genome or our chromosomes or our genetics. And I think that's because people think that this is brand new technology. In fact, it's not. The technology, the science behind mRNA vaccines is decades old. I mean, I was learning about that in my training back in the early 90s. So there's a lot of experience looking at the safety of the concept of mRNA vaccines. But realistically, I agree, the vaccines we have for COVID-19 are newer, and it's reasonable to have concerns about that. But if you, again, look at how the vaccine works, it's creating the signal, what we call the messenger RNA. It's kind of like the telegraph or the text, I guess. And all it does is instruct the human body to build a protein, the spike protein, which is how the virus attaches to our human cells, and to create an immune response to that. That messenger RNA only goes one way. It cannot go back to the sender, like the text person, I guess, and instruct that text person to create a whole new virus. Because first of all, it's only the code, the message for a small part of the protein. And second of all, we don't have the machinery in our human body to do that, nor is there any way to get the machinery to do that. Well, we basically go in one direction, which is forward. And our human body's genes are not designed to go backwards. They can't. So to those who think that the mRNA vaccine can affect their genetics or their genes or anything like that, it's just not physically possible at all, period.
The next series of questions are in reference to specific situations. The first one is, if an 11-year-old and 12-year-old are the same weight, why should my 11-year-old still get the smaller dose?
Well, the questions on dosing between an 11 and 12-year-old have come up as well. And the fact is, it's not so much about the size as it is about the age and the testing that has been done. And what we find is at that interface, 11, 12, that you actually need a little bit less to be able to get the same response, the immune response that will protect you. So there's no reason to wait. If your child's going to be 12 in 6 months and they're 11 today and they're eligible for the vaccine, get the vaccine today. You don't want to wait, because that time you're waiting, they could be exposed and get infected and succumb to all of the challenges that I've already discussed about this. So the most important thing that you should hear from me is that the best vaccine is the one you can get today. The best vaccine for the child is the vaccine that fits their age on that day that you're thinking about getting the vaccine.
My child already had COVID. Doesn't that provide natural immunity and eliminate the need for vaccination?
We get this question a lot from people who have been infected or their children have been infected with COVID and are wondering whether they need to receive the COVID-19 vaccination. The answer is yes. The COVID-19 vaccine really provides the best level of protection against the disease. There are a lot of things that we don't know, including how long your natural immunity will last after you've been infected with COVID-19. But we do know that the vaccine is safe and effective at preventing COVID-19, including the variants that are currently circulating in the United States. In addition, recent studies have suggested that people who have had COVID-19 and are unvaccinated are twice as likely at contracting COVID-19 compared to those who are fully vaccinated.
Dr. Elliott, will you address this question from a medical standpoint?
Absolutely. In individuals who have had COVID-19, they do have some immunity, some protection from getting COVID again. The problem is it's not long lasting, and it's not necessarily protective against the current Delta variant or anything out there. So I'm caring for a patient right now who had COVID a year ago and is back in hospital with COVID again and a bad complication of it. It does happen. And from the scientific and medical perspective, it happens because our immune systems react, and then they start to become sleepy, I guess is one word, and they're just not as protective against it. Versus the vaccine, on top of having had natural COVID, gives you monster immunity. It wakes that immune system right up, and you make this huge peak, this huge amount of protection, which is very protective. Is it a good idea? Yeah, absolutely. Because just having had the infection once is no protection, sadly, against getting a new variant or getting COVID again.
Is the vaccine safe for kids with food allergies or allergies to antibiotics such as penicillin?
These vaccines that have been approved don't cause allergic reactions like a penicillin, for instance. So if in doubt, if you have any concerns at all, if your child has unique challenges, has an allergy that's not quite understood, ask the pediatrician, ask the nurse, ask the doctor that you go to for your primary care. But in general, those type of allergies have no relationship to being vaccinated with the vaccines that are currently available and recommended for your child today.
Are vaccination sites accessible by children and parents with disabilities?
AZDHS and our local public health partners have worked hard to make vaccination sites accessible to everyone in our Arizona communities. This includes children with both access and functional needs, as well as other intellectual or developmental disabilities. Over the last several months, we've been working with our disability community partners in order to offer trainings to vaccination sites so that they understand the best ways to accommodate children who may have special healthcare needs. You can visit our website at azhealth.gov/findvaccine to identify a vaccination site near you, and you can even click a filter on the map on that website to show just vaccination sites offering vaccines to children 5 to 11 years old.
If a child has an allergic reaction to other vaccines, would you still recommend that he or she get the COVID-19 vaccine?
This also has been studied extensively because, of course, safety concerns are very big in approving an intervention. And as it turns out, allergic reactions in individuals prior to COVID-19 vaccine and even after their first dose have all been mild and have not been repeated in any significant way. So to put into plain English, having had a vaccine reaction, I guess, for example, to a flu shot, is not a contraindication. It is not a reason to not get the COVID-19 vaccine because there is no increased risk of any new allergic reactions from the COVID-19 vaccine. And because this is a common occurrence, people who have had allergic reactions to other vaccines who then made a good choice, got ahead and got their COVID-19 vaccine, none of them have had life-threatening infections or anything like that. So it's safe, it's reasonable, it's definitely appropriate. If, and this is an important if as a parent, one has concerns about their child with that prior allergic reaction, talk to your doctors. The doctors know the personal history of the patient far better than any scientist does. And so ask them their advice and listen to what they say.
My 7-year-old is healthy and active, normal weight, but did have asthma in the past 3 years without significant issues. Would the vaccine benefit him?
These vaccines are safe and efficacious, and our children should all be vaccinated. And I urge you to make that important decision. And if you have any questions, speak to your doctor, speak to your health provider, nurse practitioner, physician's assistant, somebody who's on the front lines and understands this. Get your questions answered. These are the people you trust. You go to them all the time for healthcare and for sick care. So I'm giving you a general message that I think will be echoed by most of my colleagues around the country, if not the world. The American Academy of Pediatrics has been very clear. Children should be vaccinated when their time comes according to their age.
We have a few additional questions that have come in. The first one is, I know people who have gotten fever and chills after getting the COVID-19 vaccine. Do children get these side effects?
So side effects from the vaccine, yeah, absolutely. In pediatrics and kids, they do occur. In general, they are much more mild than those seen in adults. And it's entirely possible that a child down the street or someplace else may have fever, may have flu-like illness, may have aches and pains, headache, et cetera. I mean, those are all reported side effects of the vaccine in all ages. The key thing, though, is that they're mild. They last typically no more than 12 hours, perhaps maybe up to 24 hours. And far more importantly, it's a very, very, very small price to pay to avoid getting the same symptoms, but a heck of a lot worse from the actual disease. So it would be great if we could say, you know, every vaccine is without any side effects. But honestly, those side effects are from our immune system doing a fabulous job of reacting to and protecting us against the vaccine's COVID response.
Can the COVID-19 vaccine give a child COVID-19?
No, it's not possible, because as opposed to old types of vaccines where a virus was being weakened and used to stimulate the immune system, in this case, this is an entirely different method of making the vaccine, and there is nothing in it that is alive. There is no virus that's there that could inadvertently cause an infection.
Does vaccination guarantee a child won't get COVID-19?
No vaccine is perfect, whether it's flu or whether it's measles. It has a high degree of ability to prevent you from getting sick or being hospitalized. In this case, the vaccine is very, very effective in keeping you from being hospitalized on a ventilator and dying. It's not perfect against preventing you from getting the disease, but in most cases, it will prevent you from getting the disease. So what's important for you to realize here is that, one, vaccines, again, are one of the most important advances in the history of mankind and science. Number two, they're not perfect. Some people may still get an infection. If they do get an infection, it's usually milder, more or less like a cold. Don't feel well, I have a runny nose, a sore throat, things like that. But again, when you look at the risk-benefit analysis and you look at the great opportunity we have to stop this pandemic from spreading and not only causing health catastrophe, but economic catastrophe, there's no reason not to get this vaccine. And I'll go back to what I said earlier. If in doubt, if your child has some unique health or medical condition that we really can't address here because these are more global and general approaches to healthy children, ask your doctor. Ask the health provider that you trust to give you guidance. And in most cases, there is no reason not to get a vaccine for your child.
I see so much information on social media. Where is the best place for me to get information on COVID-19 vaccines for children?
The most important thing that you can do is go to that trusted health professional, that physician, that nurse practitioner, that physician's assistant, the person that takes care of you. Ask them. Don't get caught up in infomercials, people selling you products, sending you on spurious journeys that have no benefit to your child. There's too much misinformation out there that is confusing all of us on a daily basis, even me. And I've been in the business for a long time, and I hear things and I have to go, gee, that doesn't sound right. And I have to go and research it. But what about the average person who's not a doctor or a nurse or a scientist? It becomes very confusing. The best place to go is to the provider that you know that you trust. If you want to go online, go to reputable places, your university medical center, the American Academy of Pediatrics, the American Academy of Family Medicine, and so on, that are reputable organizations that deal with the best science and are not trying to sell you anything.
Thank you. That is all the questions for now. Dr. Carmona and Jessica, any final thoughts?
Thank you for submitting your questions and for giving us the opportunity to provide you with some additional information. We encourage you, when you're researching the COVID-19 vaccine, to visit verified and trusted sources of information. Those include places like the CDC, the FDA, and our website at azhealth.gov.
Ladies and gentlemen, thank you so much for taking the time to reach out to us at the Arizona Department of Health Services to be able to answer your questions. You know, we really do consider it a privilege to be able to engage with you because we recognize your questions are driven by trying to protect the most precious asset you have, your children. As a father and a grandfather, I appreciate that. I applaud your due diligence. I also want to thank my colleagues, Jessica Rigler and Dr. Sean Elliott, two experts in the field. Jessica as Assistant Director for the Arizona Department of Health Services, involved in public health emergency preparedness for years on a daily basis, and really an expert. And then Dr. Sean Elliott, who I've worked with for many, many years, a professor of pediatrics, infectious disease. And I worked with him, in fact, over many years, setting up public health emergency preparedness training for our medical students, our residents, all over the state. For many years, we worked together in building these programs for just what happened in the last 2 years, to be able to make sure we had an infrastructure that was prepared to deal with any and all hazards, including pandemics. So to both of them, I thank them. They are, the best that our community has to offer, a privilege to work with them. And I think you should be assured in hearing from them as well that you're getting good, solid information to be able to make the best decisions on behalf of your children.